Ruptured tendon. My name is Dale Gill, and we will be discussing different aspects of a ruptured tendon. Today we will be discussing the anatomy of a Achilles tendon. We have a case study of a soccer player, a young student actually. We will discuss the normal anatomy of the Achilles tendon as well as the ruptured effects of an Achilles tendon. So here we go.
Hi, my name is Irene Grace, and I'm going to show you what is the case study for today. In our case study, Vera is a 20-year-old university soccer player who has ruptured her Achilles tendon in the premier game of the season. Vera is concerned that she will not be able to play at all for her final season as a university player. We're going to do normal anatomy of Achilles tendon. As you can see on the right screen, you can see the Achilles tendon, are known as calcaneal tendon. It is considered to be the thickest and strongest tendon in the human body. Also, it is made up of dense regular connective tissue. From the past classes, we knew that the dense connective tissue is made up of closely packed bundles of collagen fibers that runs in the same parallel direction. And it's also the tendon attaches muscle to bone. In this picture, you can see the origin of Achilles tendon, which is in this side. It fuses with the tendon of gastrocnemius, or known as the calf. In this picture, we could see it is the right leg, or the right ankle, the lateral side. We could see the insertion of the Achilles tendon in this picture. So it inserts to the calcaneus bones, which is this one. And as it inserts, it has the small sacs of fluid called the bursae, which is the cushion for the Achilles tendon at the heel. So moving on to the function of Achilles tendon. According to Vaskovic, it enables the triceps surae muscle to do the plantar flexion movement. The triceps surae muscle is composed of the gastrocnemius muscle and the soleus muscle. The gastrocnemius is made up of the medial head, which is this, and the lateral head. The movement, plantar flexion, is important for the toe off the foot when running or walking, as you can see here. It is caused by the contraction of the gastrocnemius and soleus muscle result in a force through the Achilles tendon. Also, one of the functions of Achilles tendon is to withstand force exerted by motions like walking, running, and even jumping. It can bear up against 10 times the body's weight. The anatomy of tendon that provides shock absorption and elasticity in the foot. So as you can see here, this is the tendon, which have the epitendon, the fascicle, and the waveform or crimp structure that we could find in the fascicle, and also in the tendon. It has the fiber, the fibril, the microfibril, and the collagen molecule.
The ruptured Achilles tendon is the effects of fibers ripped apart, therefore an incomplete contraction of the tendon occurs. This may give the appearance of a drop foot. The calf squeeze is an example of a clinical diagnosis, as well as a palpable gap along the course of the tendon and decreased plantar flexion power, all clinical diagnostics of an Achilles tendon rupture. In complex situations where clinical diagnoses are inconclusive, US or MRI may assist in the diagnostic process. A lack of connective tissue, a lack of connection in the tendon fibers affects the stability and movement. Motions include inversion and eversion, dorsiflexion and plantar flexion, gliding motion, and angular motions. A ruptured Achilles tendon would affect the normal day-to-day walking of a person, as well as can be very painful. There are treatment options. We have operative treatment options and non-operative options, dependent on the client and on the severity of the tear. Operative treatments are more often considered for high-demand active individuals, whereas a sedentary patient is more often encouraged for the non-operative treatments. We have recommended Vera with a operative treatment because there is less risk for re-rupture, a shorter recovery time, and more push-off strength. Recovery time in either options is 4 to 6 months approximately. In conclusion, a ruptured Achilles tendon, in Vera's case, is considered an acute rupture caused by an eccentric movement, such as running during her soccer game. Vera tore the dense connective tissue in her tendon, which resulted in a sharp pain, followed by a doctor's diagnosis, open surgery, and rehabilitation. Due to the extensive effects on the tendon, Vera was unable to resume her activities for 5 months, causing Vera to miss her final year of university soccer. We hope she moves on to better things. Which bone does the Achilles tendon insert? What type of connective tissue is the Achilles tendon made of? And what are 2 treatment options?